So this little series hones in a bit more on the lower limb, right? Starting from the IPK, have a think about which movement sins are most relevant to classic lower limb injuries. Can you have a little think? Maybe get out your injury recording form, a little list of those movement sins. One of the classic ones, Michelle will demonstrate it, is our medial knee, all right? Any kind of lunging, it might be really subtle. With some elite athletes, you might have to keep your eyes peeled for that little moment when they land and that knee goes boom, loses a bit of control, doesn't stay in good alignment, so the knee isn't traveling over the middle of that foot as we always like to encourage, all right? So it leads to a whole heap of issues from the foot, toe, let's be honest, right up to the sacroiliac joint. There's so much stuff that can go wrong because of that medial knee. Second thing you might look out for is that loss of leveled position here of the pelvis. So that pelvis might sag laterally. We call that can you remember the name? The trendy hip. It's the Trendelenburg sign. So somehow or other, Mr. Trendelenburg, a long time ago, named himself after that dysfunctional movement, okay. Can you remember what muscle is weak with the Trendelenburg? A few of them, but most commonly the gluteus medius. So that real kind of lateral hip, the big sort of hand on the lateral hip, that's just not firing and not holding that hip in a good alignment. So those two are probably our most common movement sins to look out for. Medial knee and that lateral shift. If you can't see the lateral shift, all right, it might be because it's happening really fast, or it could be because the client has figured out a way to compensate or even make it not look so bad. One of those little techniques is instead of sinking out, the client may actually step and go over the top of it. So it looks like a strange, in fact, elderly people suffer a bit more from that. So they'll step on it, try this, Michelle, and almost as if they are not really comfortable kind of sagging, they'll go over the top of it, and that means that glute medius just doesn't have to fire. And that's usually a later progression of the Trendelenburg. Once the Trendelenburg starts to get painful in the hip, they're starting to go, oh, I just don't like doing that, so okay, I'll do the next thing. I'll shift my body weight across the top. So have a look for that kind of really, well, they call it antalgic gait, or nasty kind of compensated movement in the elderly population a bit more. So there are two movement sins. Let's now look at some of our screen trains that are relevant. Let's do our sumo squat. The client may have a tight adductor area. So that's right, we're going for those 90-degree apart foot. So starting and then 1 foot width and 1 foot width, that's it. Got it. And then we're sinking down and we're keeping a close eye on that knee over the toe on both sides. Sinking nice and down. All right, she's really good at that. If you're looking a little bit here, it's perfect. A little bit there, it's perfect. So, okay, way and beyond the call of duty. For her, that's quite easy. A lot of clients, see if you can demonstrate it not so well. That's it, perfect. See how that knee's sinking forward? That would be evidence potentially of tightness up in here, nice and high, called adductor magnus. Classic muscle that pulls those knees in when you're going into hip flexion. That can really wreck a deep squat. One of the big sort of blockages for the hip is a really tight adductor magnus, so you get that impingement in the hip joint. So check out your sumo squat to see if that's, poor. Second one, the flamingo. So we cross it over and trying to keep our balance. You picked your right, I picked my left. Now, we're just going to sort of sink into that as deep as we can. Of course, we're assessing how mobile is this side and how stable is the standing leg side. So there's a whole heap of different bits being assessed quite quickly in a moment. So you kind of want to check one way around. Even have a look how straight is her back, very straight here. If she's really rounding, then that also would be an evidence that that hip isn't really able to open through the socket very well. Check one side and then check the other and look for a real difference in mobility and or stability. So that one will often be positive in a couple of ways. You may have that real tightness in the hip so you can't sink very low, or you might have a really wobbly hip. And of course your conclusion there would be that wobbly hip is unstable. It's not firing very well in the glute medius. Our third test is our hop to quad stretch. Those three are going to be really targeting for hippie kind of things. Hip and knee. So we're going to do a little jump right? And then grab that quad. So part of it is, can she keep the stability on that leg as she lands? And then part of it is, can she really give herself a good quad stretch while she's holding her balance on that one? So the very nature of this, when you do a real quad stretch, okay, the other side has to really posterior tilt. Now, as it's balancing on that leg, that's a tremendous requirement for the glutes to posterior tilt and stay stable. So if they're flopping all over the place, or if they're so tight they actually can't get a reasonably sort of flat back, you know that hip flexor is super tight, or the quad, or the ITB, but also that glute medius might be really under firing and weak. All right, so we're going to presume that Michelle was poor in one or those different ones. We're going to release her TFL and a little bit of adductor magnus and maybe some quads, some lateral quads. Just show you a few quick things there. So you might recall one of those really overactive and increasingly tight areas in the front of the hips called TFL, tensor fascia lata. So the way to find TFL is to just chase gently your client's hip bone at the front, the ASIS, anterior superior iliac spine. And it's going to be, TFL is going to be somewhere between that bone and the lateral hip bone called the greater trochanter. Yep, and so the way you can feel that is to find that bone. It'll be in between those two somewhere. So you can imagine the client's front pocket, putting their hands in the pocket. That's where it's going to be, right deep in there. So we need to find a way of getting good pressure in there. If you're not quite sure, you can ask the client to gently turn their knee inwards. So as she turns her knee in, she will automatically activate the TFL and relax. And again, great. See how that TFL is firing. So I'll go around the other side and I'll show you how this little technique works. There's a few ways to do it, but definitely this is our nicest one with the kettlebell. So relax that leg. Again, we get that little hip bone there. And then just grab that TFL there. And I'm going to lean from the side. It's not right on the front. Maybe drop your leg a little bit there, Michelle. Yeah. It's not right on the front. It's a little more on the side. Okay. And then that's kind of where the TFL is. It's going to be uncomfortable. It's not a happy muscle for most people. It can be downright horrible. Okay. So once we're kind of comfortable with found the spot, I'll ask her to bring her knee up, her right knee. This one up to your chest. That's it. So now back it off again so that it's not on stretch. What I do is I push and then she pulls. And we kind of fight each other. So I'm trying to hold that hip down and she's just gently pulsing her knee towards her chest. And in doing so, she's creating like a posterior tilt from this, and that's forcing this area open on the other side. Back it off again so we get it soft, and then we push, and then she's into it. It's a pretty strong technique, but the kettlebell handle is perfect for this. Again, you might do 3 sets of 10 little pulses. A nice way to sort of make sure you're getting a good effect in there. Fantastic. Maybe just gently keep a bit of pressure there. We'll swap legs, we'll go back. I might just do a little bit of lateral quads while I'm here as well. So tuck up your other leg. And then this one here with the kettlebell, we could do some lateral quad, just myofascial release. Always a favorite. See, sometimes even down in here, it can be pretty grumpy and tight. And then we might have this pressure here as she does her lift with the other leg. And then pulsing up, yeah, and release. Are we finding any triggers there? Yeah, she's feeling it. So, upper quads, the lateral quads are a real kind of common area for knee pain, hip pain, even back pain on this side. Okay, just anywhere along here if it's really tight, using the opposite leg as like a lever repeatedly is a great way to create movement underneath this pressure point here. And this is not a super heavy one, so don't be horrible about it. Just effective, gently holding those trigger points. Okay, great. Now, pop you onto your tummy. We're going to release your adductor magnus. Drop that knee up to your chest a little bit, or up and out to the side. Yeah, perfect. And then just kind of gently rotate this way a little bit. Perfect. So this is a nice way to get into hamstring, as you know. Hamstrings are really tight. Get in and do this kind of pressure work through here. Okay, especially a little bit higher to that adductor magnus we talked about. So just that upper inner thigh, just with respect, make sure you're just in the right area. Checking with the client that they feel like, oh yeah, there's a deep kind of knot there, a real sort of tender muscle. That's what we're looking for. And just a bit of deep pressure for a while. Just releasing that tension. Hamstring. And adductor magnus, okay? So, after doing some myofascial release with a kettlebell or with our other different myofascial release tools, we're going to do some quad stretching here using the suspension trainer and also some of that hip flexor and even getting it up into the belly. Some of that psoas stretching can be so good here. All right, Michelle, do our hip flexor first, okay? Key is get that knee up first, that opposite knee right up. And then you can lock out that knee and sink the whole leg backwards. And really feel that opening. Now, it's especially effective because your opposite leg is right up to your chest. That keeps the lumbar spine from not being all hyperextended and focuses the effort much more into here. Now, if I got her to get right up with straight arms, and even kind of sinking laterally, she may start to feel that shifting from the hip up into that tummy area. And that's the psoas and the obliques getting a bit of a stretch there. How does that go? Okay, and again, the key for the client is not to let that knee touch the ground. You want to keep that quad a little bit active. That really winds up that hip. Cool, let's go to a quad stretch. A little bit shorter. I can do that, yeah. How's that? Okay. So now in this position here, she can focus on just posteriorly tilting, so trying to tuck that tail under. Great, to get a real kind of thigh stretch. That's great. Once you've got that posterior tilt, then you can also add in that forward lean into the hip to get a bit more upper quad and hip flexor. Great. The way to make that more vigorous is probably to shift her whole body backwards, so we're getting more of this closeness. So maybe bring everything with you, and effectively, I might even try and tension that up or get that a little bit shorter, and that makes it even more kind of strong. Just winds up that knee flexion a bit, and you get more of the quad stretching. Great work. So, looking still at that medial knee, or the sumo squat where the knees are coming in, or the instability on the hop quad kind of drill. Any of those kind of ones, even the flamingo maybe. Mustn't forget the ankle. So can you remember that screen train that deals with the ankle? What we do is we get, let's say if we're testing Michelle's right-hand side, the right sits over the top of it, so it's kind of very much on that angle. Good. Yep. Then the knees are driven forward. And the little cue for your clients is just don't let that heel lift off on the side that you're testing. Okay? Don't let the heel lift off. And then you're asking the client, how does it feel? Does that feel like a stretch? Or does it feel as if there's some pain deep inside? Now, we hope there's no pain inside the ankle, but if there is, that becomes like a contraindication to that little test becoming a drill. So it can only become a screen train if it's not painful. You'd have to find out other ways. Use rolling of the calves, use other stretches. But if we're not in any pain, that can become a stretch, or we can get up on the power bag here and do a bit of dorsiflexion kind of stretching. Great. Straight knee, we'll get a bit more of the full upper calf, or if we drive it forward a little bit, again, presuming there's no pain or impingement type feeling, like jamming feeling in the ankle. A little bit of rotation each way just to kind of add that fascial mobility. Gets that sort of end of range. Do be careful about this with anyone who's had a history of ankle sprains. They could be quite blocked and quite jammed up. So that would be another reason to get in and do more myofascial release, or get it checked out by, let's say, a physiotherapist to make sure that that joint is actually moving okay. So one of the little things nice to work towards, once we've done some loosening, some trigger point work with the kettlebells, some quad stretching, some hip flexor stretching and so forth, dorsiflexion ankle stretching, we're going to start to kind of think about the squat movement and retraining the squat a little bit, using the power bag as kind of our foundation. It's really nice for helping the functionality of the squat. So let's get Michelle up there. We are encouraging her foot to be slightly kind of sloping downwards. So part of the value of this would be that she's on a slight decline with her feet. Okay, so in this position, after we've done some stretching, we can get her just to feel that forward knee movement. You know, we've got some loosening in here, and we're asking her to consider gently taking the knees a little bit past the line of the toes, okay? In the true squat, that's something really important to factor in, that a client may be quite reluctant to bring their knees forward, and that's definitely a sign of inactivity of the quads, maybe fear, maybe a history of injury. That's kind of something you want to start to train, start to work on over time. We're now going to focus on the closed kinetic chain movement that is so difficult for so many people. Once you've done your loosening of ankles, some quad loosening, maybe some hamstring, adductor magnus loosening, then you've got to think about how are you going to design your strengthening slash retraining kind of program for this really important basic human ability to load through the lower limb with control and with strength, you know? So we're going to start with this very basic two-legged squat movement and then progress up to supported lunges and single leg squats and so forth, trying to get that flow right through to the more dynamic stuff. The key being the use of the tubing of some sort, power bands, whatever you've got in the gym, to try and super activate underworking muscles. And you'll learn about this in Rehab Express, that there are some classic underworking muscles, all right? The muscles that lift the arch, the muscles that support the kneecap, we call that the VMO, all right? Some of those deep glute kind of muscles, classically underactivated muscles that lead to movement sins, screen train problems, and pain, all right? So, Michelle, back up on here. We're going to get right back to our basic building block of the squat. So that classic kinetic chain movement, if we go into the squat, okay, it does require, and not a lot of people get this as simply as, you know, perhaps you'd think, it does require a certain amount of forward knee movement over the toes, not just hip backwards movement, all right? That's been something we've seen so much over the last 10 years, is the tendency to only sink the hips back, not to have the knees coming forward. And then we get a slightly imbalanced kinetic link. All right, let's go again. Focusing on that knee, pushing forward, push my dowel forward, that's good, yeah. See, that's why we're doing this on the power bag. You're wondering what the heck went on the ground. That bit of a decline, that foot sloping down a little bit, makes it a lot easier for the brain to start learning a little bit of that forward translation of the knee. Why are we doing that? Because we want the quads to work hard. You would not believe how many clients have lazy quads, right? It is just, and it's in the, you know, lifting in the whole world of ergonomics is people bend your knees, bend your knees. Nobody bends their knees. Why? Because we're essentially very lazy in the quads. We are. So again, Michelle, we're going to really push that knee, push the dowel forward. See how she wants to sink into her hips a lot more? It's pretty common. So we're trying to get those quads to cook, you know. Now, if we don't go quite so deep, come up again, but keep your knees forward a little bit higher. So we take stress out of your hips, put it into your knees, good. And even just make her suffer for a little bit, you know. Come on, let's make these quads burn. Give them a bit of a wobble. You can kind of oscillate a little bit on those quads. And we really want her to get used to cooking her quads. This is a classic scenario for niggling knee problems, underactive quads. All right. One little way to make that even more interesting and fire up that a little bit more, if she's got a little bit of a niggling knee problem, let's go again, Michelle, is to get some of that medial pull of the tubing, all right? So grab whatever tubing you're going to use, and we're just going to sort of pull against her. She's going to fight me a little bit, all right? Of course, we could wrap that around both, We wanted to, and give her something to fight on both sides, but that little bit of necessary turnout using the tubing, all right, really fires up those extra little muscles. And up again, take a break. You can have it on from the outset, going down. Gives her something to fight against immediately. It'll activate her arch muscles a little, fire up a little bit that VMO. We've done the research. We've done a bit of EMG studies to prove that VMO fires up when you've got that tubing pulling across. And I am recommending you have it just under the patella, not as so many people teach across the upper quads. I don't think it's harmful, but there's a real advantage if there's any little knee pain, advantage to having it around the patella tendon. It just absorbs the shock a bit better. All right, so that movement, holding, doing, adding a bit of load, some kettlebells, just kind of pursue that, make sure their weight's even on both sides, and there's your little starting point for building good kinetic link, lower limb kinetic link control. All right, so Michelle's going to use the suspension trainer now in this little series of progressions where we're focusing in on her ability to control that medial knee that we know about. You know, that bad movement sin, or if you saw it on the sumo squat, or you saw it on her hop to quad stretch when she jumped, that knee wants to move in. All those little things, the simplest way to correct it is to use the tubing, all right? So we'll tie it on, make sure that kind of doesn't go anywhere, whatever tubing you want to use. And in this situation, she's pretty supported. She's got to fight to keep it straight. Now just lean in, just even hold that, just hold that. If nothing else, on a very low level, just get the client to feel that position. Fighting a little bit of tubing, just hold that. Make sure you feel that quad working, okay, especially down the lower part. Take it a little bit further forward, a little bit beyond. You can bring that leg forward a bit. Yep. That's it, just enough there so you feel that you can work your quad. It is my little theory that the further we take this, as long as it's safe and it's part of a progressed exercise program, the more you will build the lower quads. All right, have you noticed that? Upper quads, lower quads. Not a lot of people have well-developed lower quads. And I reckon that comes from the knee beyond the toe loaded progression. A lot of people are very hippie in their squats, and that tends to build the upper lateral quads. Leads to issues gradually if you're not careful. All right, step back. Let's now do this as a more kind of dynamic movement. So step forward, and she's got to think about controlling that from the outset. Now get that knee forward. We want that to be the component. Good. And then step back and back to square one. Good. Lunge, knee forward a little bit. That's good. Coming back. Lunge, good. All the time she's supported by this suspension trainer, so she can kind of modulate how heavily she loads into the leg if she's feeling a bit worried. There are so many, you know, post-surgery knees that never have really learned how to do this, and that's why they remain kind of a troubled knee that doesn't happily take load. You know, they end up loading a lot through their hip or just favoring the other leg, and then other problems ensue from there. So really want to get back to this challenge of loading into the knee with history. It takes time. All right, let's do a little bit more dynamic, shall we? A little bit of a jump, maybe? Okay, let's do a bit of a jump onto that right. Good. All right, so jump. Good. Jump. Good. Awesome. You get the idea. You basically use your imagination. The idea is to have the suspension trainer for support and to use the tubing to facilitate that extra movement. Then you can kind of get her to jump laterally. Let's do some jumps laterally. Yep. Supporting, challenging. Over here a little bit more, wherever you want to go. Good. Yep. How about we now do some two-legged vertical jumps? Okay, jump and land, yep. Jump and land, jump and land. So she's supported. Even running on the spot, how about that for the runner? So imagine you're kind of just running on the spot, yep. Okay, a little bit awkward, but you get the idea. No limit to your imagination. Not only can we put the tubing at the knee to create that kind of activation in those kinetic movements, we can also put it at the hip, because of course we want as much glute activation for any of those clients with that lateral shift of the hip, the Trendelenburg, or any of those kind of hip issues, commonly connected to the glutes being a little bit underactive. So if we're going to lunge forward on this one, we're going to kind of attempt to pull the hip, you know, out this way. Now you don't have to pull too hard with too much force to create the effect. Like you don't want to pull her over so she's struggling to balance. It's pretty subtle. Even if we're going back to our simple movements of the lunge or the hop or those kind of things, you might just stand on that left leg for just a moment there. Michelle, we'll just kind of see, even in this position, we can teach her how to kind of self-correct, because the tubing gives that bit of a feeling of, okay, that's where I'm sitting when I'm lazy, and then when I correct, I hold it here. Why don't you just hold it? Now, the only thing is to try and avoid tucking the tail under or sticking the bum out. You don't want to posterior tilt too much or anterior tilt too much. So kind of stay just in that mid position and just allow that kind of deep tension to build deep in the back pocket, if you like, where those important glute medius fibers are. So even if nothing else, we get her to march on the spot for a little bit. This is great for elderly clients right through to young fit clients who need to kind of get access to those little switches in their brain that help those glutes to work a bit better. So every time she's about to step on her left foot, her brain presets and starts to think about firing a bit more. All right, Michelle, let's get you to lunge onto your left foot. So now we're going to just ask that glute to be a little more active as she does a little lunge. Good. And then step back, bring your foot back to the other one. Good. And then lunge forward. Glutes being told to fire. Coming back. Lunge. Just use that for like background support up there. Good. Great. This time I'm going to ask her to jump a little bit, and just to make it a very small lunge, but do a little jump for me. Yeah, good. Hold. Yep, and down. Even just kind of pause. That's enough. Pause. Hold it. Hold it. Very good. She self-corrected brilliantly. Did you see that? Hopping back. One more of those. Although those suspension trainers not really being used very much right now. It's just kind of flopping in the wind, isn't it? So we could even, in fact, just bring them down a bit closer to. So think about using them for a bit of support, as if you needed them. I know you don't need them. All right, that's it. A bit of support. And now hop. That's it. So really encourage the client to use these as backup support. Step back, one more hop. Get that. They're not long. That's a bit too long, I think. So we probably shorten them a little bit for her if we were going to do a proper session out of it. Okay, second thing we could do is some backward steps. So kind of, let's imagine with your right leg, okay, we're going to step backwards into a deep lunge. Good. And then as you step forward, high kick with your right side. Yep. Good. Stepping back, all the while that glute's getting targeted in the middle of that movement. Good. Great. Okay, that kind of very effective super activation of her lateral glutes on that left-hand side. Great. This little drill is just the last of those glute targeting drills that kind of tries to encompass the full range of motion of the hip, starting at this kind of basic level. We call it the Trendy Challenge, all right? All about minimizing and fixing the Trendelenburg. So we're going to be working on her right-hand side here. So lift your left foot off. First point is for her to feel that hip drop and then squeeze up through there. And that's why we've got this. We're kind of leaning slightly. That increases that effect. Okay, drop again and then squeeze up. Yep, one more time. Squeeze up. This time we'll add a bit more reach with that underneath foot. Just tiptoe touch. Coming out of there, still focusing here. Reach a little further. Squeeze up through here. A little bit further. This time bring that left knee a little bit higher up. So push up, yep. Okay, and down. Nice long reach, deep lunge. Slowly adding higher push, 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 push. So we're getting that full kind of range of glute working through here as much as possible while it's learning to be stable. So that's the Trendy Challenge. Okay. So this is our little series of drills. In fact, it becomes like a little matrix where you can be a bit creative. very low stress on the hips, low stress on the lower body, so you can use it from the full spectrum of clients, post-operative, elderly, right through to fit. Depending upon how well you get accustomed to it, you can be, as I said, quite prescriptive with different components, depending upon what functional outcome you want. All of it happens on the knees. We're going to get Michelle down onto the 2 knees. So the whole point of the kneeling bag series for glute medius is to take out excess calf and hamstring activity, and hopefully quads as well. It just puts all of the effort into what the hips are doing, and that's the beauty of the kneeling bag series. So the first 4 things I want to show you, just to make sure we're clear on, is what is happening with the kneeling knee. All right, it gives us 4 different options in this little series, getting a little bit more complex as we go. The first drill is simply just using the stick, lifting this foot off. Okay, lift that left foot completely off. Immediately she's faced with this challenge of balancing on. Now, probably hard for you to see, but her toe is pushing down in this kind of way, and that's exactly what we want. We want that toe pivoting and the knee comfortably kneeling into that power bag. This doesn't have to be a sandbag. It can be any kind of really soft cushioned surface. Like a pillow at home would be just as good, to be honest. So this is our very most basic kind of start progression, where she's learning to just load through this hip, all right? Hamstrings pretty soft, calves pretty relaxed, really just challenges that hip to be loading. We'll get her to just kind of find her balance here. First step, using a stick, all right? Second step, as you can imagine, I politely remove the stick. We'll see how she goes, getting used to just balancing like that, holding that balance. Can be a real challenge, but this is not stressful, believe it or not. It's not at all stressful for your hip. Even if it's like an elderly client who a couple of months, 3 months ago had a total hip replacement, I'd be doing this with them. At some stage, they're going to have to load, and this is actually low stress. I guarantee it. So I'll put this down out of the way. You can take a little break. So we only need that dowel for that first kind of those 4 progressions that relate to the kneeling knee, all right? So our first one was with a stick. Our second progression, no stick. Our third progression, some sort of load in the opposite hand, okay? Now see if you can figure out why that applies, okay? She could have it down by her side. She could have it up in some sort of rack position up here. And maybe it's a bit heavy, I don't know. See how you feel. Want to try it? It kind of counterbalances her, so there's a sense in which it's going to help, but it is really going to challenge that lateral stability, because if she lets it go, then that weight pivots her out quite forcefully. So it's a bit more of a glute medius effort on that side. And that might be just her little strength program by itself, really testing that glute medius, testing her ability to control that lateral shift away. The fourth of the progressions would be some sort of probably overhead holding. Now, if that's a bit heavy, or you just see how you go, okay, hello, it's getting hard. Seeing how she goes, I'll just kind of be with her here, doing a great job. Very good job, giving her a bit of freedom just to figure it out. I'm here with her, but she's doing it. Take a break. So remembering that there's 2 kind of matrices that we're trying to blend. The first of the matrices was the series where we're kind of loading onto the kneeling knee, all right? So first we had mild load because we had the dowel or the stick, took away the stick, add the kettlebell on the side, add the kettlebell overhead. All of these things are making it harder for that leg you're kneeling on. So you've got 4 different options, but that's not it. There's a whole other layer you can add to that and then sort of make some combinations up. The first is very simply, and I might get Michelle just to hold that one so we're not having to think so hard about what's going on the kneeling one. This is about the free one. So the first thing we can do here is simply just lift that foot off. And that's our most basic starting point. Simply, that foot is off and she's just holding it steady. That's our first progression for the free leg. Second progression is taking that free leg from kind of heel touch right round the back to tippy toe touch. All right, lift it around, however you want to get it there, and then lean forward and try and reach and get a bit of a tiptoe touch. Just kind of within the range you feel is comfortable. You can bend your leg as you go through. That's it, whatever is easiest to get it behind. I kind of like this one as a simple assessment. Oopsie daisy, I got in your way. Just, yeah, bend that leg, take it back. That glute medius is working hard, also self-correcting because she's lifting this one to try and get it through. So it's really one extreme of forward position through to one extreme of backward position. Next little progression 3, if you like, would be to add even the 2 kind of more lateral points of contact. So like the compass, all right? North and then south and then east and then west. So you can kind of work those 4 different points of the compass with that free leg. Each time you make contact with the ground, keep that pretty light like a feather because it's all about this guy working truckloads, all right? Don't make it easy on him. And don't forget, the second progression would be with no stick. All right, so you might add in this 4-point compass and say, I think you're ready without the stick, Michelle. See how she goes? I'll give her a little bit of just, you can bend that leg as much as you want, that left one, just to kind of move it around. Good. And then wherever you want to go, yeah, good. Right through to the front again. Bend your leg, yeah. Good, through to here. So she's managing it. It's a bit of a tough call. It's a massive glute workout on her right-hand side. So she'll need a break every so often, of course. It's pretty intense. So there is just another level on that free leg, and that would be to add some sort of rotation. So she might be, instead of moving this one now, we've done what we can moving this one, let's just kind of keep that one up or even tucked behind you, wherever is comfortable. Just relax it there. And we'd want to add some sort of rotation now. So getting that thoracic spine to twist, whether we give her a Swiss ball, we get her some tubing just to kind of add in a bit of rotation that really challenges that hip that's trying to be stable. Really important for someone like a tennis player who needs to land, be stable, and then rotate. Or the golfer who needs to be stable while rotating. Or the boxer who needs to hold that position and then add rotation. Yeah, so it's very sports specific. And the very last stage there is you could do something crazy like actually add in the golf movement or add in the tennis swing. All right, and still that's all part of what you're doing while you've got that kneeling and you're doing it on the free leg kind of progression. So quickly recap, we've got on the kneeling leg, stick, no stick, kettlebell up, opposite side kettlebell or load above. All right, that's the kneeling leg. The other one is just holding it there, second level, front to back movement, third level, 4 points of the compass, fifth level, add some rotation, and fifth level, some sort of sports-specific thing. So at the highest level, you might have your client kneeling on their one leg and working their forehand, all right? Trying to balance, not going to be easy. In slow motion, just trying to get that stability while they're adding in their sport-specific movement. So there's that functional bag kneeling series for all kinds of clients with hip weakness.